CNA Written Exam Practice Test 2025 and Study Guide. Question 1. What senses do nursing assistants use to observe patients and residents? Option A, sight, hearing and touch. Option B, sight and hearing only. Option C, sight and common sense only. Option D, taste and hearing only. The correct answer is option A, sight, hearing and touch. The 5 senses are sight, hearing, smell, taste and touch. Nursing assistants use sight, hearing and touch to observe their patients and residents. They use sight to read blood pressures and to see if the person is sleeping. They use hearing when they listen to the patient and hear their concerns. They use touch when they touch the patient's skin and feel that it is warm or wet. Common sense is not one of the 5 senses. Question 2. A CNA is caring for an immobile patient and notices a new open sore to the patient's sacrum. What should the CNA do? Option A, report this finding to the nurse. Option B, place barrier cream over the sore. Option C, ask the patient how they got the sore. Option D, do nothing. The correct answer is option A, report this finding to the nurse. She should report the finding to the nurse. Only nurses can make assessments of a new open area on the skin. The sore should be reported to the nurse prior to applying barrier cream or any other intervention. Because this appears to be a pressure ulcer, it is unlikely the patient is aware it is there. Question 3. A CNA is working in the resident dining hall and notices a resident grabbing at her throat without making any noise. What should the CNA's response be? Option A, perform the Heimlich maneuver. Option B, start chest compressions. Option C, slap the resident's back. Option D, call for help and wait. The correct answer is option A, perform the Heimlich maneuver. If the resident is choking with no sound, the best response is to perform the Heimlich maneuver. Chest compressions are only appropriate if the resident does not have a pulse and is unresponsive. Slapping the resident's back may cause the aspirate to move farther into the resident's airway. It is better to perform the Heimlich sooner. If possible, call for help prior to approaching the resident.